Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Hello, welcome, and thank you for joining us today on Between Two White Coats. We have a really interesting topic that we want to talk about today, and I think it's interesting because first, it's out in the news and there's something new on it every 3 seconds, but we want to talk about vitamins and supplements. I really think in this arena, there are likely more questions than there are answers. When patients come in and ask you things about vitamins and supplements, what is just your general information you like to give them?
Often patients have already started them, so that's the thing. Sometimes patients will bring in bottles of multiple things and
so many bottles
things.
Sometimes.
And I think too, like I feel like we do well in our clinic, but something called a med reconciliation, which is what medications are you taking? But we also ask what supplements you're taking, and some patients are like, well, I'm taking this and that, and they don't really know why. They're like, oh, well, I heard this one was good, and I know
my girlfriend used it. She's pretty.
Yeah. Exactly. So I feel like there's so much information that patients are just kind of grasping, and no one's like sitting down and saying, hey, let's talk about why you're taking this or what you may need from this, or not looking at labs, or, they're just kind of just pulling it out of when they go to Walmart or when they see it on the infomercial or on the Instagram, all the things. They're just getting a bunch of them.
So there are over 90,000 vitamins and supplements available in the United States market. 90,000. And nothing has to happen for a vitamin or supplement to go into the market.
Which blows my mind.
Because
you think about how like the FDA regulates prescription medication.
So much harm can be done.
Yes.
And so let's just talk about that first. You and I, if we wanted to, could make a pretty little bottle and stick.
And it would be pretty.
And it would be so pretty.
It would be really cute.
And we could stick a capsule in it that had nothing but sand in it. And we could put on there, this will make you thin, this will make your hair thick and beautiful, and this will make you have no wrinkles. And then we could do a late night infomercial about it and become millionaires. And we could be selling a little capsule of sand. Nobody's going to stop us. There's no regulations that are going to catch that. It will only ever come back to keep us from being billionaires if something happens, someone gets hurt, and then they will retrospectively look at this and say, oh, hey, pull it from the market. But by then, how much harm could have been done? There are supplements out there that have Viagra in them that are being advertised for erectile dysfunction. And sure, yeah, it works. And so then people are going to tell their friend, this works. But there is a reason why Viagra is a prescription drug. It can cause people to have heart attacks. And so you can't give it to people with certain contraindications. But they can buy it on the market because no one's regulating this. There are weight loss supplements that have Meridia in it that's been pulled from the market because it caused heart attacks. And yet it's being put into supplements and people are losing weight and they're thinking it's safe. So first and foremost, know that this is not a safe industry. Just because you can buy it over the counter does not make it safe. You have to have done your homework. In doing that homework, the important thing is to make sure that it's been third-party tested. And so there are organizations. One that is a nonprofit is USP. USP will put a stamp on the vitamin, and they have done all the testing to make sure that what is listed is what is in there, nothing more, nothing less. And another is Consumer Lab. So if you see the USP or Consumer Lab stamp, you know that they've been third-party tested. And my recommendation, my very strong, passionate recommendation is do not take anything that does not have the third-party testing, that doesn't have USP or consumer lab testing.
If you go to pharmacies or like, Walmart, Target, now they have whole aisles and sections. So, in the past we may have said, hey, you can just grab one. Now we're like, no, don't just grab anything at the Walmart.
When I first started practicing medicine, I thought I was being patient-centered to say, just get whatever's inexpensive. Don't waste a lot of money. And now I'm like, oh, don't take it. I would rather you not take anything if you're not getting something that's third-party tested. Because when people bring it in and they hand us those bottles, it is frequent. It's at least daily that someone brings in a supplement and says, I didn't want to take this until you looked at it to make sure it doesn't interact with my medicines or that
Which we
it's
do
safe.
appreciate. Please do that.
100% appreciate. But if it's not USP or Consumer Lab certified, I can read that label all day and tell you the label is safe. But what is inside the bottle, I can't tell you a thing about it. Yeah. There was third-party testing done, random, just looking at different generic supplements. And they were testing echinacea. And this has happened lots of times, but this is one example. And they grabbed different bottles of echinacea generic, and they found 2 had 0 echinacea. One was nothing but sand. That's where I got the sand for our example of our supplement. Yeah. And another actually had minerals in it of toxic things, and had lead in it. And so it's not just that it could have nothing in it. I don't know what happens when you swallow a capsule of sand every day, but I could read that bottle and tell you, oh, echinacea, that's good. That'll help you in a number of different ways. But if you don't have a reliable company, you don't know if you're taking echinacea or something else, and it could cause you harm. Yeah. So I would rather you just not do it if you're not going to get something that's consumer lab or USP certified. And if you are taking something to help with performance improvement for sport, or if you have a kid who's an athlete or you're a college athlete, then NSF is a certifying company that makes sure that it does not have anything that is banned substances for participation in sports. And so if you are doing something where you may be drug tested, like college athletes, then make sure that you're taking something that's NSF certified. So first, we really want you to recognize that if you're thinking about just taking any vitamin or supplement, don't take it at all if it's not third-party tested.
They're not all created equal.
They are not all created equal, and they may do you some harm. So then coming to, let's say you know this, and you're looking for third-party tested, reliable supplements and vitamins. Do you need to take a supplement or a vitamin? Should everyone take one? Should people be on these things?
Maybe. It's very patient specific. We always say food first. So some vitamins and supplements or minerals you can get from food, but not all of them. And so we would always encourage that you would try to get it through your diet initially, which that's a whole nother quote unquote situation because of how our food's grown now.
Absolutely. So if you can eat a healthy diet, fruits and vegetables, lots of colors on your plate, then you may be getting a lot of your essential vitamins and nutrients. But the majority of essential vitamins and nutrients are not made in your body, so you must ingest them. And if you can ingest them through natural food first, then we want you to. But we have found over many years of testing people's vitamin levels that we can have vegans who easily get their 5 servings of fruits and vegetables all day and are shocked when I tell them you're deficient in a number of different vitamins. And they think, oh my gosh, I eat all that stuff. But today's carrot is not necessarily the same as the carrot of 50 years ago. We have manufactured foods. We have a lot of processing that happens even in what we think are whole foods. Yeah. And so you have to be more careful about where you're getting your whole foods, your fruits and vegetables. And you really would like to ask your professional, your white coat that you see, can you test me for some of my vitamins? Can we look and see whether I might need to supplement? Yeah. I think that the majority of people would agree that a multivitamin in an American diet is typically not wasted. Yeah. Most people, multivitamins have a lot of what we need. Everything except A, D, E, and K, vitamins A, D, E, and K, are water soluble. So if you get too much, you'll pee it out. Um, and I don't want you to buy something that you're just going to pee out. We're not trying to pay for colorful toilet water. Yeah. However, you don't know what you're keeping. And so just because you're peeing some of the vitamins out doesn't mean that you're not keeping some of the others. So you may have enough B vitamins, but you may not have enough D vitamin. So you keep the D, your body says, hey, that's excess B, let's get rid of it. So you don't really know what you're keeping. And I've taken a multivitamin for years. I try to have a good diet, but I've taken a multivitamin for years because I really want to fill in the holes. Yeah. And I'm pretty convinced that based on having a typical American diet where I do eat fruits and vegetables, but I probably don't get 3 or 4 servings a day like I should. So I take a good tested multivitamin every day to kind of fill in those gaps. Yeah. And I think most people would benefit from a multivitamin. Yeah. What other vitamins do you recommend or find that a lot of people may benefit from?
Vitamin D is definitely at the top of the list. That's something that we test in our clinic pretty regularly, or if someone requests it. And it has a huge range, and so I think sometimes people are like, oh, what does this mean? And the ranges on lab is 30 to 100, so that's a pretty large range. And so that's something that we can test. And so sometimes I'll say, hey, your vitamin D is 20. Like, we need to get that up. We get vitamin D from the sun. And then, of course, like, during the winter, you're not getting as much, but during the summer, I mean, we're very big believers in sunscreen. So you're blocking some of the vitamin D that you're getting. So a lot of patients, the majority of patients that I see, are vitamin D deficient.
Yeah, it's really shocking. 20 years ago when I first started practicing medicine, I didn't test vitamin D as much. But then when I started testing it, I found so high of a percent of my patients are vitamin D deficient. Yeah. At a lot of ages. And myself too. I take a multivitamin and I have more sun exposure than I should. I'm outside a lot and I have low vitamin D. So it's interesting. I think it is sunscreen and other things that we're doing right that we aren't absorbing as much vitamin D. Vitamin D is important for strong bones. It helps regulate a lot of other things. But like we said, it's a fat-soluble vitamin, so you can get and store too much of it. So if you are hearing this and saying, oh, I'm going to start popping vitamin D, we would not recommend that you do high-dose vitamin Ds without knowing what your levels are. Yeah. So 1,000 IUs, 2,000 IUs, maybe is going to be just fine. And remember, if you're taking multivitamin, you probably have 1,000 IUs or so in your multivitamin. But I would recommend that people get their vitamin D tested. And I don't like you said, big range, 30 to 100. I don't like when people are hanging around 30, particularly if these are postmenopausal women who have increased risk of osteoporosis. I'd like their level to get up to 50.
Yeah, that's kind of where I tell patients. They're like, well, where should it be? And I'm like, I like for people to be around 50.
Yeah, and then when we get it up to that level, we want to stop or pull back. Yeah. And so lots of times we'll give people bigger boost when their level's at 10 or 20. We'll give them bigger prescription boost of vitamin D, but monitoring it. And it takes a little while to get it up there. So I'll typically test again in 6 months. Twice in my career have I seen people get above 100. Yeah. It takes a bit to get up there. It is not common. And this is even when we're giving them prescription. But when they get up to 50 or 60, I take them off of the high dose prescription stuff and say, just take 1,000 a day to keep yourself there. Yeah. Lots of people, when they'll do the prescription, then they get okay, then they come off and they don't take anything. And we're just on this, it's okay, it's not okay, it's okay. And so I would recommend, if you have been on prescription vitamin D and then you normalize, to take 1,000 a day to keep it from dropping again. But vitamin D is extremely important, and we're noticing that many people are deficient in it. It is one of the things we're looking at. But our takeaway from vitamin D, a lot of people need it, but have your levels tested and make sure it's being watched, because you can get too high. Yes. Multivitamin, vitamin D, those are the two top on my list that I recommend people have. I personally take fish oil, and I recommend a lot of people take fish oil. We have a lab panel that we do on a lot of patients that has looked at their omega-3, and we then will see people are deficient in this.
Yeah. Mine was 2.4 when you tested me.
Yes.
It was very low.
Yes.
But I don't eat a lot of fish.
You don't eat fish. You know, if you're on a Mediterranean diet, if you live on the coast, if sushi's your favorite food and you can afford to eat it regularly, then you may be okay here, you know, food first. But you have to to have 3 servings of oily fish. That is salmon, mackerel, sardines, not things that people eat a lot of. I would not say, go to your local fish and chips fast food and make sure you're eating that 3 times a week. But if you're eating good salmon 3 times a week, then you may be okay on this and not need to supplement it. But fish oil has a lot of different benefits, and one of which is really helping reduce cardiovascular risk. And since the number 1 cause of death in our country is heart disease, I think fish oil makes good sense.
And it's good for joints too.
It's good for joints.
So I recommend it for patients, especially if they have arthritis or just in general joint pain. I'm like, hey, it's good for your heart, it's good for your joints. It's kind of a win-win.
Yeah, there's some research that shows that it supports mood. I wouldn't say use it in place of your antidepressant by any means, but that it can support mood, that it can reduce inflammation. Brain function, we think that it can help with general brain function. So when people say, well, what can I do to prevent dementia? And I don't know that we have massive research to support what you can do, but when we were blessed enough to speak with our neurologist friend, Dr. Juan Lacayo, on other podcasts, he said, eat right and exercise. Eat right and exercise. Yeah. And one of the eat rights is making sure that you get the right stuff in your body for your brain. Yeah. And so a good multivitamin, B vitamins, and fish oil is what I typically tell people to keep their brain healthy.
Yeah.
If you're trying to do a preventive to make sure you're doing everything you can to keep your brain healthy. Yes. And so multivitamins, vitamin D, fish oil, this is what I end up taking every day. Yes. I watch my levels on D. But I think all of those are a good idea. And then probably my 4th favorite that I recommend more times than not is probiotics. I don't think everyone needs a probiotic, but I do think that we're seeing a huge trend in America on gut health and a decline in people's intestinal health. We're hearing a lot about things that we didn't hear about many years ago, like leaky gut syndrome, inflammation in your gut. Your GI tract is responsible for the majority of your immunity. And so all in all, having a healthy gut is important.
Yeah, and you can get probiotics from food. So,
yes.
But some people just don't like yogurt or don't like kefir.
Right.
That's how you say that.
Yeah, I think that's how you say it. It's like the liquid yogurt.
Yeah.
I want to like it. I do not.
I try. I mean, I can get it down.
I throw more away than I keep.
But you can get refrigerated probiotics. But
yes.
if you cannot tolerate the kefir, then a supplement may be good for you.
Yes. So let's talk about really probiotics and a couple of things to know about them. So a probiotic is the good bacteria that lines your gut, and you must have a healthy, good-bad bacterial balance in your gut. I have read different research that says if you take an antibiotic, it can take up to 7 years to rebuild the good bacteria in your gut. And we are an antibiotic-loving nation. I mean, every day. People calling saying, I don't need to come in, you just need to call me in an antibiotic. And we're stingy with antibiotics, not because we want you to be sick, but because more times than not you don't need it, and it doesn't do no harm.
Yeah.
We do harm when we give you antibiotics that you don't need.
Yeah.
And we can tear your gut up for potentially 7 years. We're not trying to do that.
Yeah.
And so we get people who come in and they're talking about IBS and they're talking about constipation and diarrhea and a lot of different gut things. They're getting sick a lot, and they don't necessarily realize that this could be a result of the good bad bacteria being out of balance in your GI tract. And so throwing in more good bacteria, if you don't need it, you'll work it on out. And so throwing in extra good bacteria, I don't think is a bad idea. And for some people, we get more aggressive than others, but you do have to be careful on your probiotic. Not only do you want to make sure, like all other supplements, that it's third-party tested, but remember, this is good bacteria. It needs to be alive.
Yeah.
And so if it sat in the Walmart distribution center warehouse at 150 degrees for a week before it hit the shelf, it's not alive.
Yeah.
And so it has to be handled right. It could have started as a very good product and it hasn't been handled appropriately. So if you get it from your physician's office where they make sure they handle their stuff carefully and they're not doing mass amounts of things that they can't watch, or if you're getting it from your pharmacy and they're making sure they handle it well, or get it from the refrigerated section. Because if it has to stay refrigerated, you'll know that the bacteria didn't all get fried and that you're taking something that isn't
all
live.
dead.
Yeah,
It's all dead.
it's all dead and it's not going to do anything. And some of this stuff is quite expensive,
Yeah.
and you don't want to take something that isn't necessarily going to hurt you. It's just going to work its way right through the toilet,
Yeah.
and that didn't do what you were taking it to do.
Money down the drain, literally.
Yes, yes, exactly. So multivitamin, vitamin D, omega or fish oil, omega-3s, and probiotics are probably the ones that I recommend the most for different reasons. But exactly like you said, that doesn't mean that every listener should take all four of those things. This is a very specific as to what are you needing based on what you eat or what your lifestyle is. Most certainly, if you have a primarily brown diet, if
I like
chicken
when you say
nuggets,
tan.
yeah,
It's a tan and
if
brown
tan
diet.
is the color on your plate most of the time, and it's kind of a spaghetti noodle and some
French fries. 'cause
French
that's what kids
fries,
do.
yeah, chicken nuggets, then you need a multivitamin. You know, if you're not getting stuff, then you need a multivitamin.
Yeah.
But if you eat a great diet, you might not. What are the other kind of high talking point vitamins or supplements that people ask about or may want to hear more on?
A couple vitamin C, magnesium, and zinc. So those are kind of the others.
Boy, we talked a lot about zinc and C during the pandemic because
Yes.
we're trying to help people.
Immunity.
Yeah, we're trying to help have the best immune system you can. Why did some people die from COVID while other people with the same lack of comorbidities didn't really get sick? And there's lots of reasons. It's not to oversimplify it, but some of it's how good is your immune system?
Yeah.
How strong is your immune system going into an infection?
Yeah.
Why do some people get sick for a day and other people for 4 weeks? And so if you are getting everything and you are sick and you can't fight it off, you need to think about how good is your immune system. And there's good research to support vitamin C and zinc to build a healthy immune system. And I like recommending that seasonally as well.
Yeah.
When you're going into cold and flu season, winter months, add a D, C, and zinc. D will help with, you're not getting it through the sun, and then really boosting your immunity in the cold and flu season.
I personally take magnesium because I have migraines, and so it tends to help with that.
Good research to support that.
Yes, and then magnesium, which this is one of those things, like you can test your magnesium level. So it is something that needs to be tested. So you don't need to be like, oh, I have headaches. Amber said to take some magnesium.
Two things that make me nervous are when people think, well, a lot of people think more is better, and a lot of people think if I can buy it on the shelf, then it can't hurt me. Both of those things are wrong.
Yeah.
And when people are taking magnesium or potassium and never telling a physician or their provider and never getting it tested, because you can get too high and that can be very dangerous.
Yeah, very dangerous. It
Same
can
with
cause
calcium.
arrhythmias.
Yes.
So,
So not saying you shouldn't take it, but you should be following with someone so that they could look at the level.
Yeah.
And people will typically tell me magnesium really helps with my headaches, or it really helps me rest at night. And it does, and I'm happy that it's working for them. And I just test a level, and as long as their level is okay, keep taking what you're taking.
Yeah.
While you were taking it, I looked at it. You were okay. You don't need to reduce that.
yeah. So I use magnesium for that. You mentioned the headaches, sometimes cramps, like but potassium too. So it's one of those things you gotta check. But like leg cramps, magnesium helps with sleep, and then it can also help with stooling.
Yeah.
So there's a couple of reasons that
so
I
with
would
constipation,
suggest.
yeah.
I would suggest magnesium for patients for various reasons. But those are kind of the top 4 that I'm like, hey, let's check this level. Are your legs cramping because your magnesium is low?
Yeah.
So those are the most common that we discuss in office, like with my patients.
Yeah, and I might just throw in a little on collagen
yeah,
and
we like-
glucosamine, chondroitin sulfates, both of which are great for helping rebuild your joints. And anyone over 18 who's been moving has some degree of wear and tear arthritis. When you're getting into your 50s, 60s, if you've been a football player or a runner, then let's give your joints a little extra cartilage. And there's some good science for collagen and chondroitin sulfates for that. And then collagen kind of helps rebuild the stretchiness in joints as well as in skin. And there's some support for whether collagen can help prevent wrinkles and healthy skin. And so I certainly don't think that collagen is harmful, and support when people want to use that. Yeah. And we talk about that one here and there, and collagen's become quite popular in recent years. So, this is just sort of a real basic oversight as to the conversations we frequently have around supplements. There's so much information out there. I highly encourage you to speak with a medical provider who is confident in and comfortable with supplements and nutrition. Unfortunately, we get about 1 semester of training in nutrition in our training. And so you'll find some medical providers like Amber and I who have really taken interest in this and done our own reading and really tried to dive into the research. And you'll find some medical providers who this isn't their area of expertise, and that's okay. But if this is something you're interested in, engage with a provider who is interested in it as well so that you can make sure that you're taking the right stuff for you. Thank you so much for joining us today.
We like to leave you on a good note, and today's Tell Me Something Good comes from Katie. We are so thankful that you joined us for the osteoporosis episode, and you are saving lives beyond where you live because you're helping us out. So we're so thankful for that.
I like to think of it that way.
Right? Like you're just duplicating your knowledge, and it gets to save a lot of people. So that's my Tell Something Good, obviously. What's yours?
Okay. Well, mine is flowers. I love flowers. Flowers for me, and flowers and gardening for me are a way to get outside and quiet my mind and just concentrate on nurturing someone else. And in the process, it nurtures me. And then getting to bring those flowers inside my house or make an arrangement to give to someone else and make them smile is really just a wonderful, good thing for me.
Yes.
That's awesome.
I know.
Something
It's so
good
beautiful.
is flowers.
That's right.
Yeah.
Well, thank you for joining us today. And until next time, take care of yourself.